Meanwhile, Africa's top public health body has confirmed a new and deadly Ebola outbreak in a remote Congo province. The Africa Centers for Disease Control and Prevention says there are 246 suspected cases and 65 deaths so far. The outbreak, the 17th in the country, is centered in the eastern province of Ituri, near the Congo's borders with Uganda and South Sudan. Ebola is highly contagious, spreading from human to human through bodily fluids. While the disease caused by Ebola is rare, it is severe and often fatal. For more, CBS News medical correspondent Dr. Céline Gounder joins us now. She's also the editor-at-large for public health at KFF Health News. Dr. Gounder, it's always great to have you, especially on these big, important topics. What are they doing to try and contain this outbreak?
So one of the issues with this particular strain of Ebola, the Bundibugyo strain, is that there are no specific treatments or vaccines for this. Unlike the strain that we saw in West Africa towards the end of that epidemic, we did start to have some tools on hand. So as a result, you're really stuck with contact tracing, testing, quarantine, isolation, all the fun stuff from our COVID days, right?
Sounds like COVID.
It's COVID all over again, except for them in the DRC. The other key thing here is safe burials. So we saw a lot of transmission when people were basically washing the bodies to prepare them for burial rites. Those are super spreader events for Ebola. And so having teams available to pick up people who've died, to test them, to safely bury them, that's actually a really important piece of the puzzle.
So the last time the U.S. had a major Ebola outbreak was 2014. Any chance this could reach the U.S.?
Well, we've made some decisions that make that more likely, right? We've pulled out of the World Health Organization. We haven't paid our dues. We also have essentially dismantled USAID. We do still have the CDC providing some technical expertise with some limitations, but USAID was the real boots on the ground arm of the U.S. government to respond in situations like this, to provide the supplies, the staff, the spaces, like the Ebola treatment units, building that. So our Secretary Kennedy said he was going to put a pause on infectious diseases. Unfortunately, the world doesn't work that way.
So if you are traveling anywhere in that near vicinity, what is your advice?
I would avoid traveling. So specifically the places that have been affected so far in the DRC, near the South Sudanese border, and also the border with Uganda. We've seen one case now in Kampala, which is the capital of Uganda. It's a major international hub. For sure, we've had healthcare workers exposed, which means there's going to be many more cases. So I would avoid travel to that very specific region.
All right, Dr. Gounder, thank you so much.